if you're a woman of reproductive age, especially if you're trying to get pregnant and you have not popped in your tablet of folic acid today, kindly stop whatever you're doing right now and go ahead and pop that tablet. I want to give a shout out to all my old subscribers. Thank you for following up with all my videos, and to the new people here, welcome to the club. So I'll be talking about folic acid, and if you've read about it and what it is used for, can you kindly drop it in the comment section? Let me know what your thoughts are about folic acid, what it is used for. Have you ever been prescribed folic acid by your doctor? Why did your doctor prescribe it? So I'll be particularly talking about the importance of folic acid in pregnant women. You know, as your girl, I would never talk about something without it being backed up with facts. In a research done in Nigeria, in Benue State, it's shown that more than 12,000 children are born every year with a particular birth defect, which can be averted to a large extent by just using folic acid from just before pregnancy to about 12 weeks in pregnancy. So that is why I wouldn't want you to not have popped your folic acid today, especially if you're trying to get pregnant. So kindly pop your folic acid once again. So moving on, this particular brand has 400 micrograms, which is what an average person who wants to get pregnant or who is pregnant within the first 12 weeks actually needs. From that study that was done in Benue State, Nigeria, it was shown that about 50 to 70% of particular birth defect that we're talking about can be averted if you actually just pop a tablet of 400 micrograms of folic acid every day. It's mind-blowing that you can literally just prevent this condition if you just pop a tablet of folic acid every day. And that's why I'm talking about it today. Once you start thinking of pregnancy, that's the right time to start using folic acid, the 400 micrograms. Of course, there's some other people that would probably need more than 400 micrograms. I'll talk about that later, but most people would need 400 micrograms, and you will start taking it as soon as you decide that you want to get pregnant up until the 12th week of pregnancy. Why is it advised to start taking it before you get pregnant? It's because most times women wouldn't even realize that they are pregnant until about 6 weeks or later, and the process of forming the major organs in the body like the brain, the spinal cord, the heart happens around the 3rd to 4th week. So most women are not even aware that they are pregnant already by the time these organs are forming, and that is why you have to use it before you get pregnant. Most people would bring up excuses. I don't like pills, I don't even remember. Trust me, I fall into that category also. And for me, since I'm also a woman of reproductive age and I could fall pregnant at any point, what I do is put the tablets in strategic places in my house. This particular one is in my kitchen on the counter, so I always see it. There's one in my work bag, there's another one somewhere in my room, so I always know that these tablets are available. So I fix alarms sometimes around my lunch time, so when I'm having lunch, the alarm just comes up and it says folic acid, so I just pop it as soon as I see it. So that's a way of remembering to use it so that you wouldn't forget to use it, because it's very important. What exactly is this birth defect I've been talking about? It is called neural tube defect. Don't mind the big names. There are just two major ones that are very common. One is the Encephaly and the other is spinal bifida. There's one that is a bit rarer, and that's called Encephaly. And Encephaly is when part of the brain or the skull is missing, so the baby has a very small head, and most of them don't actually survive when they are born. So you can imagine that you had the pregnancy for 9 months, and when it's coming out as a child that won't even be able to survive. You wouldn't want that, and that can be prevented by just popping a tablet of folic acid. The other one is spinal bifida. So there's a deformity in the spine and in the spinal cord itself, and that happens during the process of organ formation. Those are the major types of neural tube defects. The other one, encephaly, can also occur when there's a defect in the skull in such a way that the brain now keeps bulging out through the skin. You wouldn't want that. There are other things that could put someone at risk of having a neural tube defect, like I explained, and things like diabetes, people who are diabetes, people who are obese, people who are on anti-epileptic medications, people who are on ARVs, that's antiretroviral medications for HIV, may be at higher risk of having children with neural tube defects, or if you have a family history of neural tube defects, or if you or your partner has neural tube defects. It just makes sense that you probably be at higher risk of having a child with neural tube defect. So people like that wouldn't take the 400 micrograms that is contained in here. They would take 5 milligrams. It makes sense for you to have higher supply of folic acid during that time. And also, you could be wondering that what kind of food can I eat to get this folic acid during pregnancy so that I wouldn't lack it in any way. So anything green leafy vegetables, please pack it and eat. If you're in Nigeria, buy ugu, buy tete, buy what are the green leafy, shoko, buy green leafy vegetables. That's good. And if you're in the UK, you can eat things like broccoli, things like spinach, kale, lettuce. They're green leafy vegetables. And I've seen that some cereals are actually fortified with folic acid. So some breakfast cereals like cornflakes, you can have folic acid in them. So those things can help you to increase your folic acid levels in the body. And why I'm emphasizing the use of folic acid is because, apart from the fact that it can even prevent neural tube defect, can prevent other things like congenital heart conditions. It's just like when, let me just simplify it as when a child has a hole in the heart. It can be more complex than that. It can prevent things like cleft lip. It can prevent things like low birth weight. And also in pregnancy, it can help to build your red cells. You can prevent anemia, really. So those are the things that folic acid can help a pregnant woman to do, especially preventing neural tube defects. Please, if you've not popped your tablets by now, stop this video and go and pop your tablets. If you have a wife, if you have someone in reproductive age, if you are not a woman, but you have someone around you that is supposed to be using folic acid and has not started using it, please buy it as a gift for them and give them, supply it to them so that they can start today. I hope this video has been educative for you. If you've enjoyed it, kindly subscribe to this channel for more educational content, and please like this video as much as possible and share. I don't like hoarding things that have helped me. Thank you so much. Bye.